Colostrum is the first milk produced by the breasts after childbirth. It's well known for its high level of antibodies and other factors with immune activating effects. Findings from preclinical and clinical studies suggest clostridium, a proline-rich polypeptide that's found in the colostrum, can help to prevent the progression of cognitive decline, particularly in people with Alzheimer's disease. A number of studies have found a range of the possible mechanisms of clostridium's beneficial effect, including modulating the immune activity, preventing the oxidative stress and oxidative damage to the DNA, reducing inflammation, and inhibiting the overproduction of nitric oxide, and by decreasing age-related mitochondrial dysfunction. A randomized control trial compared clostridium to a placebo in 105 subjects with mild to moderate Alzheimer's disease. The clostridium group received 100 micrograms of clostridium every other day for 3 weeks, followed by 2 weeks with no treatment, for 3 5-week cycles. After the first 15-week period, all the subjects received the clostridium for a second 15 weeks. The clostridium treatment had a stabilizing effect on the cognitive function and the ability to perform activities of daily living, and the participants with mild cognitive loss responded better to the treatment than those with the more advanced loss. Another trial used the same dosing schedule for 16 to 28 months in 33 Alzheimer's patients, and it found that it resulted in the stabilization or the improvement in the health status. An earlier clinical trial included 46 patients with mild to moderate Alzheimer's disease, and they were assigned to receive either 100 micrograms of the clostridium, 100 micrograms of selenium, or placebo in cycles of 3 weeks, followed by 2 weeks without the treatment for 1 year. 8 of the 15 patients who were treated with the clostridium experienced improvements, and the other 7 had no change in their condition. In contrast, none of the patients in the selenium or the placebo group improved, and some of them worsened. Studies have reported mild side effects that resolved quickly in some of the patients treated with the clostridium. Vinpocetine is a synthetic derivative of an alkaloid from the periwinkle plant. Vinpocetine has demonstrated neuroprotective effects such as altering inflammatory signaling, reducing oxidative stress, improving cellular energy production, inhibiting the thickening of blood vessel walls, dilating cerebral blood vessels, and possibly preventing atherosclerotic plaque formation. In a placebo-controlled trial in 26 patients who'd experienced multiple strokes, the vinpocetine prevented the deterioration on one test of cognitive function after 3 months. Other studies using oral vinpocetine have noted its ability to improve the cognitive performance in patients with mild cognitive impairment, as well as with cerebrovascular insufficiency. Women who are pregnant or could become pregnant should not use vinpocetine. Lithium is a mineral and is used in high doses as a mood stabilizer, primarily in patients with bipolar disorder. But lithium is naturally present in trace amounts in drinking water, and a higher occurrence of lithium in the drinking water has been correlated with lower rates of dementia and psychiatric disorders in population studies. A growing body of preclinical evidence suggests that lithium may have neuroprotective effects through its ability to prevent the oxidative and inflammatory neuronal damage, to enhance neuroplasticity, to modulate protein metabolism, and to regulate the circadian rhythm and the hypothalamic pituitary adrenal axis. In addition, animal and lab research suggests chronic low-dose lithium treatment can increase the neuronal production of brain-derived neurotropic factor. A meta-analysis of 3 clinical trials included a combined total of 222 subjects, and it concluded the lithium therapy might be beneficial for individuals with mild cognitive impairment and with Alzheimer's disease. Because of lithium's substantial potential for toxicity in the higher doses, microdosing therapy is especially appealing. In one trial, the Alzheimer's disease patients treated with the lithium with a microdose of 300 micrograms per day had less cognitive decline than the untreated patients. The difference in the cognitive function was significant after 3 months and progressively widened during the course of the 15-month trial. Microdose lithium has been shown in rats who are predisposed to Alzheimer's-like pathology to reduce oxidative stress, neuroinflammation, and abnormal protein accumulation, as well as promote neuronal regeneration and to prevent memory loss. You could check out my video on lithium orotate for more information. Cocoa is made from the seeds of the cocoa tree, and it's high in concentration of free radical quenching polyphenols called flavonols, and there's mounting evidence suggesting that it can improve the vascular function, promote cerebrovascular blood flow, and strengthen the cognitive function. Findings from lab studies suggest that it can also inhibit the aggregation of beta-amyloid plaque. In addition, the caffeine, the catechins, and the other constituents might also contribute to its benefit on the brain health. Examining data from 2,056 participants in the seniors study on nutrition and cardiovascular risk in Spain, the researchers noted the daily consumption of 10 grams or more of dark chocolate in the previous year was associated with better cognitive performance and a lower risk of mild cognitive impairment when compared to not eating dark chocolate. Another study in 531 subjects aged 65 and older found chocolate consumption was correlated with a reduced risk of cognitive decline during approximately 4 years of monitoring in those with low caffeine intake. In a randomized control trial in 40 healthy older individuals, taking a cocoa drink providing 494 milligrams of flavonols once a day for 12 weeks increased the blood levels of brain-derived neurotropic factor, and it improved cognitive function. An 8-week randomized control trial compared the effects of supplemental drinks providing different amounts of the cocoa flavonols in 90 cognitively normal elderly subjects. At the end of the trial, the cognitive performance on some of the tests improved in those who were receiving 1,000 milligrams of cocoa flavonols per day compared with the lower amounts. In addition, those who received the 1,000 milligrams and the 500 milligrams had improvements in insulin resistance, blood pressure, and lipid peroxidation, which is a measure of oxidative stress, when compared to those who were receiving only 48 milligrams per day. In a 3-month randomized control trial in healthy older adults, eating a high cocoa diet improved the regional brain function as well as cognitive performance. Spearmint is an aromatic herb, and it's rich in water-soluble polyphenols, many of which have anti-inflammatory and free radical reducing properties. Rosmarinic acid and its derivatives generally make up the greatest proportion of spearmint's polyphenols. Rosmarinic acid has shown neuroprotective effects such as reducing neuroinflammation and brain oxidative stress, and preventing beta-amyloid-induced cognitive decline. Rosmarinic acid also appears to inhibit an enzyme that's involved in tau protein pathology. In addition, the spearmint has also been found to inhibit the enzyme acetylcholinesterase, an action that might increase the levels of acetylcholine and thereby help support learning, memory, and mood. In a randomized placebo-controlled trial, 90 individuals with age-related memory impairment received either 900 milligrams, 600 milligrams, or 0 milligrams per day of high rosmarinic acid for 90 days. Those who received the 900 milligrams performed better on memory tests and reported improved ability to fall asleep when compared to those who were receiving the placebo. In a pilot trial in 11 subjects with self-reported mild memory impairment, 30 days of treatment with 900 milligrams per day of a high rosmarinic acid spearmint extract resulted in improved performance on tests of reasoning, attention, and concentration. Even short-term administration resulted in improvements in attention and concentration that were noted within 2 to 4 hours. Oats, or Avena sativa, is a cereal grain and has many active compounds. An extract from the wild green oat has been shown to inhibit an enzyme called monoamine oxidase B. The activity of the monoamine oxidase B is to metabolize dopamine, and this increases in older age, so it lowers the dopamine levels, and it possibly drives the oxidative stress and the mitochondrial dysfunction and accelerates the tissue aging. Blocking the MAOB helps to normalize the dopamine levels, and this can reduce the oxidative stress, and it can improve aspects of cognition and memory. The wild green oat extract has also been found to dilate cerebral blood vessels and to inhibit another enzyme called phosphodiesterase, an effect that may slow age-related cognitive decline. In healthy adults, 1,500 milligrams of wild green oat extract increased arterial blood flow by slightly more than 40% when compared to a placebo. In healthy middle-aged adults, a single 800 milligram dose of wild green oat extract improved performance on a test of attention, delayed recall, memory, and executive function. In patients with mild age-related cognitive problems, 1,600 milligrams of wild green oat extract improved the performance on a test measuring attention, concentration, and the ability to focus on a task. Lion's mane is a culinary and medicinal mushroom from Asia. The extracts have been shown to have anti-inflammatory and oxidative stress-reducing effects, and the consumption of the lion's mane has been reported to be associated with neuroprotective, pro-cognitive, anti-aging, and antidepressant properties among its other health benefits. In a randomized control trial in 30 older individuals with mild cognitive impairment, the daily treatment with 3,000 milligrams of powdered lion's mane for 4 months resulted in the improvement of cognitive function relative to a placebo. In animal research, the lion's mane enhanced the neuronal function, improved memory performance in healthy wild-type mice. The extract of the lion mane has also been found to stimulate neuronal growth factor and the formation of new neurons, as well as decrease the beta-amyloid plaque and the amyloid-induced inflammation in a mouse model of Alzheimer's disease. PQQ is a vital compound and it supports the growth and development. It plays a critical role in oxidation reduction or redox biochemical reactions, in which the electrons are given by donor molecules and taken up by recipient molecules. Redox reactions are fundamental to virtually all cellular processes. Preclinical research suggests boosting the PQQ levels can improve the mitochondrial numbers and the function. It can reduce systemic and brain inflammation, increase cell longevity, protect against neurotoxins, and possibly improve the neurological and cardiovascular health. A number of studies also show the PQQ can prevent the accumulation of the beta amyloid, and furthermore, the PQQ has been found to stimulate the production of a protein called nerve growth factor, to promote the regeneration of nerve cells, and to preserve cognitive function in lab animals. Research findings suggest the PQQ can improve the cognitive function by increasing the regional brain blood flow and the oxygen use. In a control trial in 41 healthy elderly subjects, 20 milligrams of PQQ per day for 12 weeks resulted in increased cerebral blood flow and slower decline in cognitive performance when compared to a placebo. In addition, the participants with the lowest cognitive function at the beginning of the trial exhibited improvements in one aspect of cognitive function at the end of the trial. Another study similarly noted taking 20 milligrams of PQQ daily for 3 months increased the regional brain blood flow and the oxygen utilization in healthy subjects. Nicotinamide riboside is a form of vitamin B3. Like other forms of B3, the nicotinamide riboside is a precursor to nicotinamide adenine dinucleotide. The NAD is a universal cofactor and it plays a critical role in oxidation reduction or redox biochemical reactions, where it converts to its reduced form NADH. The redox reactions are important in cellular energy production in the mitochondria. In addition, the NAD appears to participate in regulating the enzymes that govern an array of cell functions, including gene expression, metabolism, DNA repair, apoptosis, which is programmed cell death, and aging. Aging is associated with decreased NAD+ production, and a decreased NAD+ to NADH ratio has been correlated with mitochondrial dysfunction and age-related and metabolic disorders like cognitive decline, dementia, diabetes, obesity, non-alcoholic fatty liver disease, cardiovascular disease, and some cancers. It's thought by raising the NAD+ availability, it can contribute to slowing the aging process and prevent age-related diseases. In healthy elderly volunteers, 250 mg per day and 500 mg per day of the NAD+ precursor nicotinamide riboside safely and dose-dependently raised the blood levels of NAD+ after 4 weeks. In mice, administering oral nicotinamide riboside has been found to increase cerebral NAD+ levels and to improve cognitive function, to enhance neuroplasticity and reduce tau protein-induced neuronal damage. Further evidence from animal studies suggests the NAD+ therapy could possibly stimulate mitochondrial activity, maintain the regenerative potential of the stem cells, and extend the lifespan. For more on age-related cognitive decline, continue on the series, or for information on herbs, supplements, and natural treatment plans, check out my website.